Hi everyone, I am Dr. Raghav Malik, consultant, cataract and refractive surgical sciences at Center for Sight. Today we'll discuss what is presbyopia. So presbyopia is something that everybody on planet Earth, every human being is actually going to face. So what happens is we have to understand how the eye is made. So our eye actually is a very good, very advanced camera. So there is a lens inside the eye that is held by inside the eye by a certain amount of muscles and zonules. So these muscles and zonules actually work diligently throughout your entire life. So when you are young, so these muscles are very strong, such that when you look at something at distance and something at near and you quickly shift focus, these muscles swiftly contract and relax, making your lens thicker and thinner and giving you the ability to look at something at a distance, at an intermediate distance and at a near distance without the need of glasses. But around the age of 40, 41, 42, these muscles and zonules start getting weak. So let's see what happens now. Now these muscles are not able to function as normally as they used to when you were young. So now you can look at something at a distance, but immediately when you look at something near you, like let's say your phones, your eyes are unable to focus. When your muscles are strong, they could, but now at the age of 40, they cannot. So this weakening of muscles and zonules is called presbyopia. It is a natural phenomenon. It is not a disease. It is something that happens to a normal human being. It is similar to graying of your hair and graying of your fingernails. It's something as normal as that. Everybody does face it. Yes, traditionally we can treat this by the help of glasses. That is, at the age of 40, we give you something known as progressive glasses, where you can have vision or power for distance as well as intermediate as well as near. These glasses take care of all your needs, known as progressive glasses. There are multifocal contact lenses that give you this ability to look at distance as well as near. We can also treat this with cataract surgeries. So let's say you are 65 and you want to get rid of glasses. We can put in some lenses known as a continuous range vision lenses, multifocal lenses, or trifocal lenses, or EDOF lenses, which can actually give you this multifocality. That multifocality which is present in your normal crystalline lens, which you have since you were born, which you lose after the age of 40, can actually be replaced by an artificial lens which has the same functionality. That is one more option. But what about those people who are 40 years of age, have power for distance as well as near, but don't have a cataract? Yes, there are options for you too. There are laser-based procedures, there are lens-based procedures that we can do to remove your power for distance as well as near. There are certain amount of laser-based surgeries known as PresbyMAX or PresbyOND that actually remove your power for both distance and near, and you can actually enjoy a spectacle-free life above the age of 40 also. We also have lens-based procedures wherein we put a phakic IOL or an ICL inside your eye, which has power for distance as well as near. So this way we can, and we have multiple options where we can treat presbyopia.
Follow Planet LASIK and post your queries to get answers from the experts.